eat clean. So hey Lanita, thank you for joining on. So my energy, I have to say, and to God be the glory on this, I do have good energy. What does it mean to eat clean? No hormones, no antibiotics, and no pesticides. So if you try to eat clean and get my amount of water in that I should get in, so that way my energy levels can keep up, so I can keep up with the type of schedule that I keep. So, and then again, hey Bishop, thank you for joining on. Please like, invite, and share as you come on. Hey Auntie Diana, thank you for joining on. So what I try to do, because like I said, we take the doctor's office to the patient. So I'm in the house, out the house, and I think I'm going to weigh my bag tomorrow because my bag is kind of heavy. I'm quite sure it's about 40 or 50 pounds. Hey Cheryl, thank you for joining on. So we take the doctor's office into the house, and then today I had some people that lived in flats, so I had to take them upstairs. But anyway, I have to be physically fit for that. I have to have the stamina for that. I have to have the energy for that. I can't be going in there dragging and all that other kind of stuff, and then telling them and sharing them the information that I'm sharing with you, with them, and then I'm tore up from the floor up and don't have energy and be talking about how tired I am or how sleepy I am. So but anyway, so the benefits of cold and cleansing or having a clean diet is energy. Believe it or not, we talked about, I remember this, elimination of bad breath. Bad breath can be caused by food which is not properly digested. Bad breath is also a symptom of imbalanced food choices, or a food choices that consist of processed foods that are not enough fresh vegetables, which can increase the chances of bad breath, along with bloating, weight gain, constipation, gas, skin problems, insomnia. Bad breath can be an indication of parasite infection. Um, Colon cleansing can get to the root of and beneath the problem in elimination. So and believe it or not, a colon cleanse also is a good way to manage pain management. So this is some of the things that I have to talk to with my pain management patients, because some of them are on some heavy duty narcotics, which can cause constipation because it decreases the movement of the gut, which is called peristalsis. And so if they are constipated or bloating, yes, their pain will definitely go up. So after colon cleanse, back muscle aches are drastically reduced because the toxins in the body are also are being released as a person eliminates. So that's very, very good to have a good bowel habits. Um, we are taught in medical school that everybody's bowel habits are different. We're taught that, everybody's pattern is different. Hey Lisa, thank you for joining on. We're taught that you got to ask a person to keep a diary. Some people go every other day, a couple of days or whatever. Now, hey Stacy, thank you for joining on. Now that I know what I know and have done some research and studying on my own, believe it or not, the best bowel habits is eliminating after you eat. So you should be having a bowel movement every day. So that what we learned in medical school to me is an X-nay. I don't believe that anymore. Um, so it should be an elimination a few times a day, at least 3 times a day if you eat 3 times a day. And the myth of about eating 3 times a day, that's a whole nother show too. So, but anyway, you should have good elimination every day, okay? So urination and defecation, it should be done every day. So, and it helps with pain management because you're releasing those toxins. Clearer thinking and stress relief from a colon cleanse. If you are not eliminating every day, you're holding toxins in the body. So if you're holding toxins in the body, because let me tell you how this goes. You eat your food, it starts to break down with the saliva and everything in the mouth. You swallow it, it goes down to the tummy. The tummy has the acid, which is a low pH, breaks down the food. It goes through, and then you got bile from the liver and enzymes from the pancreas that's putting enzymes in there that break down the food, go into the gut. and through the GI tract, and it takes the nutrients from the food and transfer it through the bloodstream from the gut to go to the rest of the body. So if the food is just sitting there, so guess what? And it's toxic, bad food like fast food, processed food, just sitting there, toxic stuff with pesticides and stuff on it in it. So that is being transferred from the gut into the bloodstream. So then your bloodstream goes through your whole body. So it can affect the skin, it can affect the hair, especially your thinking, your thought, and clarity. How about I went into the room and I forgot what I went into the room for? That is a sign and sign of people like, well, that's a sign of me getting older and older or mature, mature. No, it could be a problem with the food choices that you're making. It could be a problem with not drinking enough water to flush out the toxins out the system. So you have, or fogginess. I've heard people say that they feel foggy throughout the day with their thoughts, or they're trying to talk and can't get the words out, or whatever the case may be. That is a clear, classic sign that a person needs to detox or do a detox, okay? And it could be a signs of other things too, but we're talking about detox today. Clear thinking and stress relief, of course. Listen to this. Additionally, many toxins are known to have an adverse effect on emotions, leading to irritability, anxiety, depression, and decreased tolerance to stress. When proper colon cleansing is used, you will be able to think clearly, emotions will be balanced, stress levels will be dramatically reduced. So, cleansing and detoxing with a colon cleanse does a myriad of things, okay? Let's talk about immunity here. Your immune system is in your gut. And I've said this before. So if you got all this gunk in your gut, right? How can your immune system work? So most people that don't eliminate like they should have bloating, have constipation. Most of them have problems with sinuses. They have a problem with cold and flus, just feeling run down and tired because their immune system cannot function like it should because all the toxins are just sitting there in their gut. Okay. Um, so once you also get a benefit of a colon cleanse, like it'll boost your immune system. So proper colon cleansing will remove the congestion along with boost immunity. So most oftentimes, what I tell people when they want to do a cleanse or weight the beginning of the weight management, I tell people to eliminate dairy from their food choices. And why is that, Dr. Patterson? First of all, dairy is from a cow, and we're the only mammals that eat another mammal's secretions or milk. And I've said this before, and dairy is one of them. So, cheese, if you melt the cheese, right, and you eat it and it goes into the gut after it cools down, right? It was warm, and guess what? It solidifies back. So it can lock the bowels, that we call it. So cheese can do that. Cheese, dairy is also known to increase mucus production, and it has been scientifically proven that mucus breeds disease. Oh no, yeah, I like cheese too, y'all. So I'm talking to myself when I talk to you. Hey Lisa, what do you say? We are schizophrenic mess eating those dead animals. Yeah, yeah, yeah. I've been doing good, guys. Um, I haven't even been keeping track, but I haven't. It is May now. May, April. I want to say I haven't eaten meat since the end of January, maybe, or the beginning of February. I can't remember. So I'm like, January, February, March, April. So I'm like 4 or 5 months in. I haven't had any meat, so I've been really doing really well. And I feel great. My energy is off the charts, so I really feel good for that. But for a while, it was kind of like a challenge for me, but but I was like, I'm gonna do this because I want to live longer and I want to be an example. What does that say? Yes, yes, yes. So it's been a while since I've had meat. Chemical good for you. Yes. So thank you, everyone. I'm going to try. Yeah, you should try it. And there are so many things out there that you can try that taste like meat. Do you eat fish? No, I wish I could eat fish, Cheryl. Cheryl, you don't remember I have fish allergy. So God has not fresh. I should say fresh fish allergy. So I just don't mess around with it at all. So it'd be smelling good though. But no, to answer your question, no, I don't. However, can that affect your energy level? However, can that affect your energy level? Jacqueline, you said something I don't understand. However, can that affect your energy level? I can't. Did you say something earlier? I can't see what you said, Jacqueline. I'm sorry. But yeah, so, but anyway, let me go on to regulating the eating process. The colon cleanse will not only help you lose weight. I remember the first time, there's also products that you can buy to colon cleanse, and there's actually places where you can get a colon cleanse done with a machine. So, so I remember having my first colon cleanse with a machine, and and I went to go have it done, and I lost 10 pounds. So I was saying to myself, I had 10 pounds of waste on the inside. That really freaked me out. But anyway, and it was a good experience. It was kind of weird, but anyway, I did have it done. It's been a while since I had one done by a machine, but believe it or not, since I'm eating more fruits and vegetables, I haven't seen a need for a machine, I guess. But I think maybe I might try it when June comes, at the end of June, because I haven't done any meat for, it'll be June will be, I guess, about 5 6 months for me. I might go try and do a colon cleanse by a machine. Um, so yeah, do I recommend those? Yes, you got to make sure you do your research. You got to make sure that of course it has to be a clean place. You can do a tour before you get it done or decide where you can do it done. Most people would that do them would love to take you through their facility. You want to make sure that they all their equipment is either disposable or autoclaved. They will definitely, what is autoclave? Where they sterilize it with steam and heat, and then they will show you how the different settings on the machine works and what does what. They would love to have you to show you how everything goes before you and answer all your questions before you make an appointment and actually have it done. I tell everyone to make sure they do their research, and anything on the internet now you can look at reviews and things of that nature before you decide to go that route. So, in regards to losing or releasing weight, a colon cleanse ensures waste is properly removed from the body in minimum time. That means that your appetite will be healthier and you will be less prone to overeat if you have a colon cleanse. Believe it or not, most people tend to overeat when they're toxic because your body is like all over the place. Because you got to remember, when your stomach expands, it sends messages to the brain, hey, we have food down here. So if you're not, the food is not being processed properly and you're not getting the nutrients that you need, your body will be feeling hungry all the time because it's not getting what it needs. So it's like, I'm hungry, I'm hungry, I'm hungry, I'm hungry, I'm hungry. So please put more food down here. And believe it or not, a lot of processed foods, fast foods have chemicals in it that is actually banned in other countries that stimulates appetite to keep people eating. So yeah, that's true. Only in America, right? So let me see. Let's talk about liver and gallbladder because that's part of that digestive tract. The liver is a vitally important organ, and the gallbladder flushes the liver cleanse. The liver cleanse can help you keep it operating at optimal level. Now, this is very important that you can also do a liver flush. I kind of recommend a liver flush for those that I know that have come off chemotherapy or they're doing some type of doing their natural route for certain type of cancers. So we actually recommend a liver flush because your liver is very, very important to removing toxins from the body. And so anything is diseased in the body is considered a toxin. So anybody that is fighting any type of disease, especially a cancer or any type of disease really, but especially a cancer, your liver needs to be functioning at its best to remove those toxins, especially if a person decides to also do chemotherapy. I'm not totally against it because there has been some positive things from it, but there is some literature out there that says that it's more does more damage than good, and I do believe that as well. But then, what do you say to a woman who has had breast cancer, did chemotherapy, and she survived it, and she's living? So, so there's some upsides and downsides to it. It's always you have to uh, weigh the risk against the benefits. But then my thing is, after a person goes through that process, we need to build the body back up. And traditional medicine does not train doctors to do that. So sometimes I get those patients after the fact, and I'm having to go through this process of restoring and replenishing and helping the body to do what it naturally does and replenish and rejuvenate itself. And one of the things that we do, we recommend a liver flush because the liver has to remove the toxins from the body. So, we actually have a recipe from things that can buy from the grocery store for a liver flush for that. There are some things on the market that make claims that they do liver flushes. So I don't have any products to recommend for that. But like I said, we do have a recipe where you can actually go to the health food store and buy different things to actually do your liver flush at home. Okay. The gallbladder flush removes some of the pressure put on the liver by removing the gallstones or gallbladder stones. Actually, the flush, you can actually see the stones in the toilet. And ask me how I know because I've done a gallbladder flush myself. So the stones can obstruct the delivery of bile to the liver and the gallbladder when you break down your food, which is very, very important. There are some people under the sound of my voice that already have had their gallbladder removed because the stones were so big or whatever the case may be. So the doctor decided, because they used to have real bad pain or whatever. So the doctor decided to remove it. So should you still do a liver flush? Yes, because your liver is still there. So yes, you can't. I'd highly recommend that. The liver function, the liver screens the blood for toxins, viruses, and bacteria, detoxifies alcohol and certain drugs, and plays a major part in supporting the body's immune system. So I just said that. There are a particular set of cells. So this is for you science buffs out there or any providers that are out there that are listening to the show on tonight. Do you guys remember in histology Kupffer cells or Kupffer cells, Kupffer cells? These are a type of white blood cells to destroy viruses, bacteria, old blood cells, and other substances it filters, and they are found in the liver. So that is why it's very, very important to make sure that your liver is functioning well and detoxifies it. We also do IV infusions for vitamin supplements that actually go into the vein, and we actually push it, or we have soon we'll have these little balls that actually administer it for us. And it has glutathione in it, which is a highly potent antioxidant that the body needs, and it works at the level of the liver, and I love this. So it's one of my favorites, to be honest. The glutathione infusion along with the vitamins. So a damaged liver, which is less effective in fighting infection. So those of you who are under the sound of my voice that like to drink, and I don't, for religious reasons, in the Bible, they drank wine. I don't believe in hard liquor or anything like that. The Bible clearly states that wine is good for the belly, and it's used for medicinal purposes. And Jesus' first miracle, he turned water into wine. We all know that. But you also got to remember, for every drink that you take, it destroys some type of cells in the liver. So you got to be careful with that, because people that are chronic alcoholics or things like that, they can develop what we call cirrhosis of the liver. So if you get cirrhosis of the liver, then your body can detoxify itself. I remember twice in my career where we had this mentally challenged young man who was mentally retarded. Um, and his family, I don't know, started him on drinking, and he had cirrhosis of the liver because. And but my thing is, who was buying the liquor for him and getting it to him? That was my whole thought. But anyway, and then it was another young man that I had in a nursing home. He was in his 20s, and he was an end stage liver failure, and there was nothing that we could do for him. And believe it or not, when a person that young and is an alcoholic, they're not number one on the transplant list. So it was a big old ugly mess. But anyway, I said all of that to say that you got to be careful with what you put in your body. You have to make good choices every day, because where your body is today is from thoughts, choices, and decisions of yesterday. So let me say that again. Where your health is today is from thoughts, decisions, and choices of yesterday. So guess what? A lot of people that have health challenges say in their head, if I can only get back to where I used to be. No, no, especially if you don't want to go where you used to be, because that person made the wrong choices to get you where you are now. What you want to say is, from this point going forward, I'm going to make the choices that I need to make to be the best me that I can be from now going into my future. So you got to make sure that you make good health choices in regards to what you put in your body every single day. Okay, so now let's talk about did the liver. We talked about that. I talked about the liver function, and so we talked about how it does that. Um, Oh, listen to this too. Believe it or not, even prescription medications can be very, very hard on the liver. So, anticonvulsants or seizure medications, if you're on any of that type of stuff, you got to make sure that your doctor checked your liver functions. If you're on cholesterol medication, two adverse or side effects that or adverse effects that cholesterol medication can do can cause muscle aches and pains. So if you're someone under the sound of my voice on some type of cholesterol lowering medication and you have muscle aches, you need to tell your doctor, because the cholesterol lowering medication could be what's causing the muscle aches. Number two, cholesterol lowering medication is very hard on the liver. So you got to make sure that your doctor is monitoring your liver functions if you're on those type of medications. Okay. Um, Damage will compromise the liver's ability to absorb certain vitamins, especially fat soluble vitamins, which some of you medical Mondayers who have been on with me for quite some time, vitamins A, D, E, and K. Hey, Susan. I see some people that just got on. Hey, David, thank you for coming on. Thank you, thank you. Please like, invite, and share. Hey, Sunny B, thank you for coming on. Hey, Lanita, so you got to make sure that vitamin A, D, E, and K is very, very important. They're fat soluble vitamins, so they have to be absorbed through fat. And the liver is responsible for absorbing fats through the liver. So, but if the liver is damaged, it can't get those vitamins absorbed like they should. And vitamin A is very, very important in night vision in your skin. Vitamin D has been very, very important in synthesis, because the sunlight hits the skin and it makes vitamin D from cholesterol. And so, and those are the precursors and structures for, hey, Pastor Joy White, thank you for joining on. Hey, LeBaron, thank you for joining on. So once it hits the skin, and there's precursors for vitamin D to make cholesterol. Vitamin D provides structures to making certain hormones in the body. Vitamin D is very, very important. So it has been, if you can read literature, if a person is coming in for a heart attack or something, not only are they giving them heart drugs, they are now infusing them with mega doses of vitamin D, because we have gone, especially being that we are the skin color, especially if you're a brown person or African American, um, the UV rays, some of them are blocking. We don't make as much vitamin D as we should, and then a lot of us don't get enough sunshine. And if you're here in Michigan, you don't know when you're going to get some sunshine, and then they're telling you to put on this SPF 15, 20, and 30, which is blocking the UV rays. So most oftentimes when I see patients, I always get their vitamin D levels, and I have yet to meet anybody or any of my patients that had an adequate amount of vitamin D. The reference range is 30 to 100. I have yet to meet anybody or anyone that had the appropriate amount of vitamin D that they should do. But you got to be careful with vitamin D because fat soluble vitamins A, D, E, and K can be stored in the body and can be toxic. So you don't readily pee those out. So you got to be careful with those because you don't want to get toxic from that. Okay. Vitamin E is a good for skin, hair, and nails. And vitamin K is for bleeding disorders. I have met women that have come to me recently. I've had a patient. She was vitamin K deficient, and one of the side effects for vitamin K deficiency is heavy menstrual cycles. And she said, I had a hysterectomy. I think she said about 15, 20 years ago. And I was like, you probably was vitamin K deficient then. But, like I said, but trust me, guys, it's not that doctors are withholding information or withholding care. We're not trained to look at supplements in medical school. We're just not. So, and she was like, well, they probably wasn't thinking that. And I told her, I said, I'm quite sure they weren't. So, some of you out there that might be having heavy cycles and things of that nature. Um, and vitamin K is not a routine test. Vitamin K is what we call a vitamin. And so it is not on routinely tested for. So you would have to go to an alternative doctor such as myself or someone else that's in alternative medicine to for them to test you for it to see if that is your issue before you talk about a hysterectomy or things of that nature, depending on your age and all of that good stuff. So, recreational, or what they're talking about as far as drugs, I just said, talked about that. Foods, let me see where autoimmune, we talked about that. There are things that can affect the liver also is hepatitis, viruses, and stuff like that. And I already talked about cancer, so let me go ahead and move on. Liver damage symptoms. So let's talk about liver damage right here. I know this is all a part of detoxing and understanding that if you or your liver is not working, then you have a detox problem. So fatigue, lack of appetite, loss of energy, weakness, weight loss, nausea, jaundice. And what is jaundice? You remember you hear about jaundice when a baby is born, yellow jaundice, they have yellow skin and they have to put them under this UV light, or they tell the mom to breastfeed more to get the jaundice out of the baby. Jaundice can be a sign of bilirubin in the blood, which can be a sign of liver damage. The white of the eye is yellow. The skin can have this yellow tone to it. So those are the things that are signs of liver function and poor detox. Lighter color stools, longer blood clotting time. Like if you cut yourself, the person, it's hard for a person to stop bleeding. Water retention. So all those things are signs of liver damage. And the reason why I'm spending a little bit time here is because now you're seeing all these commercials. Quite sure if you're watching television, be it Netflix, whatever, they're talking about testing for hepatitis C if you're born before a certain year. I think like in 1945 or whatever. They were recommending that people get tested for hepatitis C because hepatitis C, if it's gone unchecked, can cause cancer and cause liver damage. So make sure, and these are signs and symptoms of that. And hepatitis C is a virus. If it's gone unchecked, can cause a problem. All right. Gallbladder symptoms: severe abdominal pain, chest pain, tenderness, heartburn, unusual colored stools, and vomiting. So, and how does this all play in detoxing? If you don't detox appropriately, you can damage these organs. So it's very, very important that we do some type of detoxing. Okay. I also like to talk about mind detox. Yes, you need to detox your mind. You got to watch what you in your eye gates, and you got to watch what you put in your ear gates. I'm going to do a video clip where I talk about different type of energy. Everything is an energy. God is an energy. Your energy. The Holy Spirit is an energy. Everything has a positive or a negative energy. Murmuring, complaining emits a negative vibration, negative energy, which breeds ground for disease. It is what it is. So as a man thinketh, so is he. You know, all those things will promote either health or disease. There's no in between, believe it or not. There's no in between. Well, kind of like an in between on a way, either going back or forth. How about that? So, because I do believe that you can reverse things. I really do believe. I really do believe in the power and the healing of the Holy Spirit. And I do believe in, because the Holy Spirit resides in you, that means you have the power within you to control what you hear, what you see, and what you confess, which will allow you to be able to promote a good, healthy lifestyle, mentally, emotionally, and spiritually, and physically. And how about we're gonna throw another one there, and financially too, because life and death is in the power of its tongue. So you got to make sure that you monitor your thoughts. I did a whole show on that too, right, guys? There's 60,000 thoughts a day. How many of them are negative? 85% of them. And how many of them are repetitive? 95%. So you do have to do a mind detox. You just got to get quiet sometimes. A lot of times I deal with people all day long. I'm in my car a lot. So after a while, I like to listen to praise and worship music. I like classical music too. So, but after a while, sometimes I just want to just drive home and I just want quiet. Um, and then after my prayer and praise and worship, sometimes I just want to be sit there and quiet and in the presence and the peace of God and just be quiet. You have, and that's a form of meditation. You need to be quiet. Your brain is like a muscle in the body. Okay, so when you work out, you need to have some type of recovery time, right? So if you work a couple of times a week, like I do, like say either 3 to 4 times a week, you have to have some type of recovery for your muscles and for your body. Your brain is an organ. It's Yes, your brain is an organ. It's like any other part of your body. It needs some recovery time. It needs some downtime. And I hate to say it because I'm on social media. You need to detox from social media sometimes. I mean, social media is a great time robber. You can go on there to do one thing, because I use it mostly for business, and I'm on there trying to invite people, trying to get my next thing up for the next show and all of that. And then I look at a video, then I get to another video, and another video turned to another video, and I'm like, oh my goodness. And then an hour went by, and I'm like, I could have used that hour for something else. But again, don't get sucked into that. Make sure you manage and watch what you're doing in regards to that, because it can keep things going. So you got to make sure that you detox. Well, yeah, you got to detox your mind, and you got to make sure that what you hear and what you see is more good going in than um, than bad. Okay, because I can go months without watching the news. I can go through stuff and read one liners to find, because I want to have a conversation about news and what's going on in the world. So I might read the news headers, but I am very particular about watching the news, because the news can start at 4 o'clock and go into 7 o'clock. And if you sit there and watch it from 4 to 7, they're saying the same negative story over and over and over again, and then it's getting into you, it's getting into your brain. So you got to be careful. You got to monitor what type of things that you let in. It says very informative, wish I could stay but have to teach a session now. Oh, okay, thank you for joining. Thank you so much. I'm about to be done in about 4 minutes too. So thank you for joining. Is it Nadia Smith? Thank you for joining on. Thank you so much. Hopefully you shared the broadcast. Thank you so much. So we're going to talk about cellular cleanse within these last 4 minutes. If you guys have any questions, try to put them up there. I'm going to try to answer them the best I can. Um, um, Cellular cleanse. Cellular cleansing is what is cellular cleansing? The only truly effective way to comprehensive type of detox is a cellular detox, also known as cellular cleansing. Cellular cleansing is designed to remove harmful toxins from the body where they are causing the problem at the cellular level. So, most of the time, the best time to do this is when you're fasting. Let me say that again. Most of the time, this is the best time. A cellular cleansing is when you're fasting. So, and I talked about this last time when we talked about detoxing. At that time, you should be drinking distilled water because distilled water kind of like bathes those cells. It's kind of washing those cells and cleansing those cells. And then especially if you're doing an extended fast, anything beyond 3 to 7 days. If I'm doing an extended fast, I'm definitely within that first stint, I am doing distilled water. And if I'm going past the 7 days, of course, it's led of the Holy Spirit. I after that I switch to alkaline water because now after I'm cleansed those cells, I want to put everything into a homeostatic state as far as pH is concerned. So, and that is what a cellular cleanse. You can also use some supplements at that time, some liquid supplements to also to clear at the cellular level. One of the things I love to use is called Cleanse for Life, and it's nothing but food, but it's in a juice form, and it comes in like in the little shots or whatever. But it helps a clear at the cellular level, and it's not running you to the bathroom either. So those are the things that I do personally, and those are some of the things depending on where my the patient is and what they're trying to do. Those are some of the things. Now, this is just general overall. This is not tailor made specifically for you. Most oftentimes, we do a assessment at Bethesda Holistic Center, and we tailor make your health plan, your detox, your fast, whatever, tailor made specifically designed to you because I need to know your history. I need to know where you are, the past medical history. I need to know where you are right now and where you planning to go. So we need to do what we call health mapping. So I have to assess where you are and where you want to go and how we get you there. So it's tailor made, specifically designed for you. It's not like one size fits all. Okay. Household cleansers. You got to make sure you got to detox your home. Household cleaners. You got to look for mold. You got to make sure if you have cloth furniture, you got to get it cleaned. Of course, we talked about foods. No antibiotics, hormones, or steroids. Plastics. You got to make sure that if you're drinking out of plastic, it's PBA free. Paraffins, which can cause cancer, especially if you have water bottles in your car during the heated time. You got to make sure your carpets are clean. Keep your appliances clean. I do not microwave. I have a microwave and I don't use it because those are waves. Yes, they are microwaves. Yeah, so I don't want anything that's sending unnatural, putting anything that's in there. Okay, let's do this. I don't know if you guys ever seen this before, but it was this experiment that was done with regular water and microwave water. And they had two plants. And they took the microwave water and poured it on the plant and regular water on the other plant. And the microwave water plant died. So, yeah, there are some radio waves activity going on in the microwave. So you need to be mindful of that. If I want to heat my food, I heat it on the stove like my mom used to do when we were little. Of course, your drinking water, air quality. You got to make sure that your air ducts in your home, which I got to get done because now we're going from winter to spring. I have to make sure we get our air ducts cleaned. You got to make sure if anything that you got to make sure that throughout your home, if you have rainfall fatigue, you got to make sure you have your carbon monoxide detector in your home. Things I've had a friend, one of my patients' brother who passed away, trying to help someone fix a furnace, and they had carbon monoxide poisoning. Young man wasn't sick at all, and he died from carbon monoxide poisoning. So these are all the things that you need to make sure what they call electromagnetic fields, EMFs. You got to be careful with those type of things. Cell phones. I hate to see women put cell phones in their boobs or in their back pocket or anywhere around their reproductive areas. That is radiation. So you got to be careful with that type of thing, okay? So I think that's it for detoxing right now. It's 9:01. I appreciate you guys tuning in. I'm going to make sure I make an appointment with you when I come home. Oh, that'll be nice. Thank you so much. Thank D. Henry for joining on. I thank you all for joining. And I know I went over a lot of information. I'm Dr. Grace Patterson from the Metro Detroit area, managing owner of Bethesda Holistic Center of Everything New, where we target 5 areas of anti-aging, sports performance, wellness, energy, and pain, and all natural pain management. And we actually bring the doctor's office to those that are sick and shut in and that cannot get out. So, from this elderly, the disabled, quadriplegic, belt bound, wheelchair bound patients, we actually bring the doctor's office to them, and I share the alternative stuff with them too. So I just don't just I just make want to make sure we treat you from the inside out. Yes, I will pray and lay hands if I'm led to. Yes, I will. Most oftentimes I'm laying hands anyway when I'm doing my exam. Most patients know what I'm doing, and most patients say, "We're gonna pray today. Pray with me today, Dr. Grace," and I have no problem with that. So I thank you all for tuning in to Medical Monday, where we are here every Monday at 8 p.m. We're going to have 2 great shows coming up. We're going to be talking about the all natural pain management, and we're going to be talking about if you had an opportunity to take a test to tell you where your brain is right now, and if there is any deficiencies, if there's any signs of memory loss or deficits or Alzheimer's disease or dementia, would you want to know? And how much would you pay for that test? And we can supplement that. And we're thinking about offering this test, but we want to make sure people are interested in it before we take on another way of helping you. So, but we got to make sure that there's some type of interest there. So we thank you for joining in. Go to our website, www.bw-center.com. Please go to www.bw-center.com. Our telephone number is 248 356 1111. That's 248 356 1111. I think I said 4111111. Yes, I am Dr. Grace. I appreciate you for tuning in. Please like, invite, and share. And for you replayers, we appreciate you taking the time out to invest in you to be the best you that you can be by listening to this information, and not only listening to it, applying it and being the best you that you could be. Thank you so much. Grace and peace. God bless. Bye for now.